Okay, so this is chapter 21, objective 5. So just a real quick, brief discussion on deficiencies and overreaction of the immune system. So, uh, actually, your immune system can actually not see pathogens. Pathogens are able to hide within the body, the evasion of pathogens. Um, so, some examples of some situations where that occurs. I think we discussed Mycobacterium tuberculosis, TB, in a previous objective. So this is when the bacteria, it's a bacterial infection, um, develops this cell wall that is resistant to the digestive enzymes of the macrophages that ingest them. So macrophages are supposed to ingest it. Bind, the pathogen is going to bind with the lysosome, creating the phagolysosome, and then it will be ingested. Well, Mycobacterium tuberculosis can develop this super complex cell wall that is not able to be deteriorated, so they actually don't die. That's one way in which evasion can occur. Another one would be something like with Staphylococcus aureus, uh, which is become resistant to antibiotics. So a person, when they get a bacterial infection, they take antibiotics to get rid of it. Well, with Staph aureus, some strains are no longer able to be destroyed by the antibiotic. They are antibiotic resistant. An example of this is MRSA, methicillin resistant Staph aureus. Those folks that have that usually need to stay in the hospital, get special antibiotics that are not resistant. And there's only, one or two other kind of antibiotics. So they're keeping those to where those are specifically delivered by the hospital. So the hospital has control over making sure the patient gets exactly what they need. That's why they say when you are administered an antibiotic, you take all of it until the very end, because if you don't, some of that bacteria is able to survive, and it will cause that infection to come up again. But this time, the bacteria have learned they've already been exposed to the antibiotic. Some of them can become antibiotic resistant. And that's what's happened with Staph aureus here. So mutations can occur. Bacterial surface molecules mutate continuously. Virus as well. This is why there's um, you know, the flu vaccine that comes out. It's always different. The flu mutates very quickly. HIV virus mutates very quickly. So by the time the vaccine is made, the virus doesn't look like it does anymore. So the vaccine isn't going to work against it. So those bacterial surface antigens are able to change, again, hiding from the immune system. They don't recognize them anymore. Genetic recombination. So you guys have probably heard of swine flu, H1N1. It's been a little while, but it's not been too far in our past that we've been dealing with that. So this is what happens when uh, combining of gene segments from two different pathogens. Two viruses infect the same cell. Two different viruses infect the same cell. So you get a recombination of these viruses. So where you have two viruses, now you end up having one virus, hence swine flu. It came from a human and a pig flu virus. They came together, and now you've got a new virus, which is now able to evade your immune system. And then another one, pathogens can also produce these immunosuppressive molecules, such as HIV. Various diseases, um, immunodeficiency, it could be genetic, it could be acquired. We just talked about HIV a second ago. Genetic, there was a movie out a long time ago. It was called Boy in a Bubble. Um, it was severe combined immunodeficiency disease. It is an X-linked trait, which means it's passed from mother to son. Now, boys have XY chromosome combination. X came from mom, Y came from dad. So if the mother passes it down, she's passing down the mutated X chromosome to the boy, to her son. There's no offset to that. So that means they have the disease. Where if it's X linked and mother passes it to daughter, daughter can get a healthy X chromosome from dad and just be a carrier. But yet, if if the mother passes it to son, they're only getting that one X chromosome. So there's nothing to, again, that's the disease that they get. So it's sex linked is what it's called, because it's on that sex chromosome. So anyway, what it is when T cells and B cells are affected, it affects that adaptive immunity, which is your T cells and B cells. So severe problem. And then also acquired immunodeficiency, HIV. Um, there's also such thing as hypersensitivities. These are allergies and inflammatory responses to non-pathogenic environmental substances. Non-pathogenic. So there's different types: type 1, type 2, type 3, type 4. Type 1 is going to be rapid, it's going to be allergies. Type 2 is going to be something like erythroblastosis fetalis. Oh, I'm having a hard time saying that one. Hemolytic disease of the newborn. That one's a little bit easier to say. Same thing. And there's a picture up here, and this is where it's the baby's blood, which is Rh positive, is mixing with the mother's blood. Mother is developing an immune response to the Rh positive antigen, and that antibody is attacking the baby cells, because that antibody can pass from the placenta, through the placenta, from mom to baby. Type 3 hypersensitivity would be like lupus erythematosus. And then type 4 sensitivity is going to be something delayed, like a TB skin test. If you guys have ever had a TB skin test, they give you a little bit of it, and then they kind of mark where it was. They have you come back within 24 to 48 hours to see what kind of reaction you have. Autoimmune response. This is when the body starts attacking itself. So autoimmune diseases such as, let me back up, lupus, erythematosus is actually an autoimmune disease, a type of autoimmune disease, along with rheumatoid arthritis, another autoimmune disease. So this is affecting the adaptive immune response, which is mounted against self antigens. So again, you've got markers on the surface of your cells as well. And when your immune system recognizes them as foreign, which they are not, and attacks them, that's your autoimmune response. So it's the normal consequence of a foreign antigen. It's supposed to clear that from the body. That's normal. Okay, that's what normally happens. But when that immune response develop against the body's antigens, the ones that are supposed to be there, you're going to get an immune response that occurs. That's going to result in chronic inflammatory injury to the tissues affected, and then it could actually cause death. Okay, that's all for Objective 5.